Well, tonight, Changemaker is a healthcare company using telemedicine to help some of the most vulnerable members of our community. StationMD works with the ADAPT Community Network in a real innovative way to help reduce unnecessary trips to the emergency room.
Changemakers, brought to you by ADAPT Community Network, empowering people through innovative solutions one person at a time. We change.
For members of the ADAPT Community Network, healthcare can be a complex issue. And now the coronavirus lockdown complicates that even further.
What has it been like during this time? Because I certainly know it's not easy, and you guys are having to, adapt and learn other techniques for dealing with the community.
It's been very difficult training staff to deal with this pandemic. Every day things change. So.
Rose Wargo is a vice president of nursing for ADAPT. She says her partnership with the telemedicine company StationMD has helped community members in the residential programs avoid unnecessary trips to the ER during the COVID-19 crisis.
We call into them where the doctor's able to do EKGs, stabilize people. So many people did not have to go to the hospital because of StationMD's assessments while the people were at home.
The program includes 24-hour access to an emergency physician that they can reach through the computer screen.
Just to have a resource like that at the tip of our fingers is wonderful.
We've been able to really do some good work with organizations like ADAPT.
Dr. Malik Trivedi is one of the co-founders of StationMD.
And our primary focus is really providing quality care using telemedicine and telehealth as a solution to the IDD population, and that's the intellectual and developmentally disabled population.
Dr. Trivedi says their physicians have access to patients' records, can e-prescribe medicine, and conduct virtual examinations.
We have a camera that allows us to zoom in and look at rashes. We have a Bluetooth stethoscope, which allows us to listen to heart and lung sounds. We do a thorough physical examination.
Another benefit, family members can take part in calls, and if it's determined the patient does need a visit to the ER, StationMD will call ahead to the hospital.
So the doctor in the ER knows what they're getting. They know this case we've done this already, and this is what the doc thinks we need to do.
Do you think this is something you'll keep using going forward in some capacity?
Well, right now we're part of a grant, and we're only utilizing StationMD in 13 of our sites. Just seeing how wonderful it's working out now, I don't see why we wouldn't want to expand it to all of the sites.
All right, well, we'll be following that. StationMD says another benefit of their service, their doctors typically follow up with patients after an hour or two following their consultation. StationMD believes this could be the new standard of care for vulnerable populations in the future. By the way, if you know a good change maker, reach out to me on Facebook at Tamsin Fidel. Love to hear from you.